So today I'm going to be talking about something that stops a lot of therapists and nonprofit founders from growing their practices, and that is hiring. So if you've ever asked yourself, what if I hire someone who doesn't align with my mission? What if I have no idea how to train or onboard them? What if I don't even know how to supervise? And what if I can't afford to do it anyway? So, if that's you, you're in the right place because the truth is, building a nonprofit group practice requires a team. But hiring that team doesn't have to be overwhelming, risky, or expensive if you have the right approach and you approach it with the right intention and the right systems in place. So, today we're going to be breaking that down. So today, in today's training, we're going to go over the four biggest hiring fears, practical solutions to hiring, and systems that work specifically for hybrid nonprofits. So, for those that don't know me and are new to my group, my name is Dr. Lauren Lawson. I'm a licensed marriage and family therapist in California and Pennsylvania. I've worked in nonprofit community mental health settings my whole career. I've climbed the ladder. I've been in executive leadership. And 13 years ago, I started my own nonprofit in California. And now we have grown to Pennsylvania. So, just to give you a little bit of an idea of my team and how we're set up, I have clinicians across the country. I manage them. I have a director of operations under me, and I have some licensed clinical supervisors in my practice. But we currently have an operating revenue of around 300,000, and we grew that last year from a little under 200,000. And we have a team of about 12 clinicians, including myself, and most of them are part-time clinicians. So I want to share with you what's possible to do in the nonprofit setting that is not community mental health and how to do it differently. So, in part one, we're going to talk about mission alignment. How do you screen for values and culture fit? So, this is a really big fear, and that fear is real because your mission isn't just a tagline, it's your why. It's so important to you. You're not just working for another agency, you're the one starting this, you're the one that feels passionate about this. So, when you're bringing someone into your nonprofit to hire them, you're not just hiring a clinician, you're hiring someone that's going to be the culture carrier, right? People that are going to carry the culture. So here are some ways that you can vet for alignment when you're hiring. You want to start off and have a really clear vision and values statement in your actual job posting. So make your mission visible and make it non-negotiable. And during the interview, you can ask mission-based questions. And so some examples of that are, how do you approach working with underserved communities? How do you approach working with these specific underserved communities that we serve in our nonprofit? And then you could ask, tell me about a time that you've had to navigate an ethical gray area with vulnerable clients or with clients in this particular population that we're serving. And what you're looking for are answers that both show heart and alignment with your model. You're not just looking for like a polished resume. The bottom line with hiring that I have had to learn this lesson like over and over and over again is that hiring aligned people up front saves you so much time and so much money later. You can train skill, but you can't train values. So start with hiring based on values, not based on skill. So, fear number two is not having the appropriate onboarding systems. So, we're going to talk a little bit about why onboarding matters so much and what it should specifically include. So, if you don't have any onboarding systems, definitely pay attention and get out your pen and paper because this is absolutely crucial to get people to stay. So, without onboarding, you're just throwing people into your world and hoping that they figure it out. This is a recipe for burnout for both you and the clinician. So I'm going to walk you through the four-part onboarding flow that I teach. The first one is pre-onboarding. So in pre-onboarding, this is where you're going to make it super clear about how you want to set the culture and the tone from the beginning. You want to have a welcome email, a welcome card, a welcome letter, and a digital packet with things that include your mission, your vision, your values, your organizational chart, their schedule, required trainings or readings. This sets the tone that you care about their onboarding and you're not just throwing them to the wolves. People want to know when they start on their first day, they want to know where they're supposed to be. They don't want to have to be figuring it out by themselves with a really messy onboarding system. In fact, there's research around that if you're going to lose a new employee, it's going to happen in the first 30 days because of poor onboarding. So you can use a simple Google Drive, you can use a notation folder for access, you can have something printed out in a binder, whatever works for you, but this builds the trust before they even start because you're setting the tone to how they actually walk in that day. And this does not matter whether you are um, in person or if you are virtual, you do the same exact process. The second thing that you're going to do with onboarding is the first weeks, right? So orientation. And this is really introducing them to like the core tech, how you have your tech set up, how you have your system set up, your EHR, your email, telehealth platform. Like you want to make sure that you have clear onboarding guides that they can follow with screenshots so they know exactly what to do. You're also going to show them and give them a little tour of like your policies. So your cancellation policies, your documentation deadlines, supervision cadence. You're setting the expectations right from the beginning and you're being super clear and direct about this. So they need to know what is their role, what are their expectations for clients and boundaries. All of this goes to the culture of your organization. I usually like to pair them with someone. So whether it's someone, another team member or colleague that pretty much carries out the culture of your nonprofit, or it's another supervisor, someone else that they can get to know in the organization that they can go to and ask questions as well. Now, this person is not meant to be like their formal trainer, but someone that they know they can connect with and can go to if they have questions, in addition to any questions they have for you. So, the third part of onboarding is really a clear training plan. This is hands down absolutely necessary. You need to think of this as like clinical scaffolding. You want to guide them, not dump on them. So, you want to start with some observation, have them watch your sessions if possible, any past recordings that you might have. You may assign one or two clients with support. And again, this might be different if you have a licensed clinician, but it does depend on the licensed clinician as well. So it really does depend on how tech savvy they are, how long they've been working in the field. Yeah, I kind of try to follow the same format regardless of years of experience. And then if I see that they're picking up really quicker, then we can just move the process through faster. But you want to use structured check-ins. You want to definitely check in with them at the end of week one, week two, week four. You want to set clear learning objectives so they know exactly what's expected of them. What should they know by week one? What should they know by week two? When are they supposed to be fully ramped up? When do they start taking on clients? That kind of thing. So SOPs. We're going to talk about SOPs. So many people do not have SOPs. SOPs are your lifesaver. They are your standard operating procedures, and they are clear instructions for repeatable tasks that people have to do in your organization. So, creating SOPs sometimes can be a long process, but it is one of those things that saves you so much money in the long run because you're going to reduce turnover with really good SOPs. So you want to create SOPs for how to document a session, how to bill, how to schedule clients. What do you do when a client first calls your organization? What is the step-by-step process? What do you do if clients are running late? Or what do you do if the clinician is running late? Or if the clinician needs a day off? What's your process for that? They don't need to be fancy, but it is super helpful to have it in a written, clear format and to have a video that matches it. And you can record this on Loom and then you could store it and you can use this same training over and over. And it's for ongoing employees as well. It's a working document that you update ongoing as your processes and policies change. And it's something for people to reference. So, Google Doc, that's your SOP equals gold. This is absolutely necessary. And if you ever find yourself that you're repeating yourself more than once, then it is time for you to sit down and write an SOP. So let's talk about fear number three. This is not knowing how to supervise. I get this all the time, especially from clinicians who maybe aren't licensed but know that they want to be a supervisor for I hear this all the time from people who have been licensed for a while in private practice, but they want to expand to the group practice, but they really have never supervised. And then I get experienced clinical supervisors all the time. So I'm going to teach you how to do a framework and tools for effective clinical supervision. So, a lot of us were thrown into supervision without a framework, and you're not alone in that. So, here's what helps when you're thinking about becoming a clinical supervisor and hiring people in your agency. You want to identify a supervision model, whether that's the developmental model of supervision, whether that's the systemic model of supervision, reflective model, systems model. Just be consistent and know why you're doing it. So for me, I work from a developmental model as my frame, and then clinical theory is more of a systems model. I am very into systemic clinical supervision. So the developmental model has three phases, right? It's the first phase is you're being really directive because you have a brand new clinician. The second stage is you're hopefully being less directive and they're being more proactive and saying, "Oh, I want to conceptualize this or help me think through this." And then the third stage is really where they're prepping for licensure and they should be bringing the clinical issues to you. So it's a really good framework to be able to track people, kind of understand where they are developmentally in their clinical process towards licensure. You absolutely want to have a clinical supervision. Whoops. Did I skip ahead here? Agreement. So a supervision contract, whatever you're going to call it, but it should cover frequency and format, what you provide versus what's expected, any emergency protocols. It should have like a training plan in there for them. You should also create a supervision log. A log is different than a supervision contract. Contract is what you do in the beginning that outlines the overview of clinical supervision. A supervision log is almost like a progress note. It's something that you document ongoing weekly every time you meet for supervision. And this is so important to not only cover your license, but to make sure that you are covering all legal and ethical standards within the supervision itself and you're documenting it. So you might, and they don't have to be super long, but you can use client initials and say CM discussed or AP was discussed. And so you'll just say what cases were discussed, any any feedback that you gave them about their documentation or clinical guidance or any safety things that you asked them to follow up on. And also, anything else that's going on with them within the agency. Like if you need to give them feedback and they're not following that, then this is something you can document in the supervision log. You don't have to be a perfect supervisor, but you do need to be present, prepared, and committed to their growth. I can't tell you how many times I have met with supervisors who were supervising me, and the door was open for clinical supervision. Other people just walked in during supervision. They were late, they were multitasking, they were painting their nails. Like the amount of stuff that happens in clinical supervision is wild, and that sets a tone for how then that clinician is going to interact with clients. It is a parallel process, and supervision time needs to be protected. So make sure you have a clear framework for providing supervision. Okay, so part or fear number four, you can't afford to yet pay any clinicians. So let's talk about some phased hiring approaches and funding strategies to bring people on if you feel like you can't afford it. This is probably the biggest block for people, but I want to shift your thinking. Hiring doesn't mean that you have to start someone full-time tomorrow. So here's how I teach hiring in the Thriving. Impact program, and that's through a phased hiring model. So it may start out with some school affiliation or practicum interns, people who are working towards their masters. This is mutually beneficial and it is free. And then you get to train the clinician from the ground up. This is really, really beautiful. A lot of people don't want to do this because they're like, oh, well, that's such a super green clinician. Actually, training green clinicians is much easier than retraining licensed poor clinicians. So I will die on that hill. I fully believe that. I've experienced that 10 times over in my career. I would much rather have a green clinician brand new in school and train them myself. Again, you can train skill, but you can't train values. So bring on then, so then you have your interns, that's free, and it's a way for you to generate money, right? Because even if you're charging a sliding scale, you're not paying the intern. If you're billing Medicaid, then all of that can go towards overhead and paying the cost of you providing clinical supervision. And then you can bring on one or two part-time clinicians, maybe after your practicum students graduate. It's a great way to continue continuity of care for clients and also to continue the career path for that clinician. And you want to pay them hourly. You want to pay them per session. Do not start out as salary. That is not feasible in our field. It is just not set up unless you have different types of contract other than fee for service. And Medicaid billing, Medi-Cal billing, Medicare billing, insurance, commercial billing, that is all fee for service. So that is how we need to structure our pay. Um, you can also go and find local grants to help offset the cost. So I'll talk about that and how to kind of explore that. But that is a possibility, but it is not a necessity. You don't need grants to start hiring. You want to reinvest early funding into building up your staffing capacity. This is going to pay off in the long run. And if you follow everything that I taught in this, then you're going to reduce turnover, and that is going to save you so much money. So, some funding sources to explore right now in terms of grants are local mental health foundations. This is absolutely where I would start. You can go to your, like Google your local county, and you can look for corporations that support the mental health field. And a lot of times, those corporations might have grant opportunities or funding opportunities on their websites. You can also look at regional behavioral health boards, intern stipends for schools. Sometimes that happens. It really depends on the state that you're in. And then United Way chapters, local Rotary clubs, like all of that stuff is where you want to find your early funding. So you don't really have to choose between your mission and money. You just need a funding informed hiring plan so that you're just not hiring a full-time salary clinician right out the bat because you're just going to lose money that way. So I think I already mentioned this part as some ways to find some funding sources, but key takeaway is you can hire aligned people, systems make onboarding easy, and funding can support your growth. I don't know why my camera went blurry all of a sudden. It doesn't matter. But how can I help you? So, everything that I'm teaching today, I actually have these templates ready to go. I use them actively in my nonprofit. I tailor them all the time. I have three different options for services if you're interested to help, if you want me to help you build out your nonprofit group practice. So, I have my done for you package, which includes not only all of the paperwork to get your nonprofit off the ground, but I can also custom create anything that you need in terms of onboarding or growing to a group practice. So that can include supervision agreements, affiliation agreements, email templates to reach out to schools to build up those partnerships. As well as W-2 forms, independent contractor forms, supervision log, comprehensive evaluations for interns or for associates, whatever you need, I have it and I create it and tailor it towards your nonprofit. I also have a self-study program. Oh, so the done for you package is 997. And then the self-study program is 897. Basically, this is if you want to go into my course, have lifetime access to it, access all of the templates that I have, and do it at your own self-pace. This is the program for you. It's kind of like you can log in, listen to it like a podcast, download the template, use AI to help you tailor it towards your nonprofit. But you get lifetime access to this. So this is a really good deal because anytime there's like an update to it, you automatically get that, even though you've already paid for it. And then I have my full coaching program, which is 3,900. That includes lifetime access to the coaching course that's online. It includes every single template that I have, and it includes live coaching with me and with a mindset coach that I have on my team, and a grant writer, fundraiser on my team, and an operations specialist. So it gives you full access to all of us for live coaching. We do live coaching either definitely minimum 2 times a week, 3 times a week when we have our mindset coach come in. So it's really hands-on to help you take the material that you're learning in the course and actually apply it. So if you are interested in any of those, let me know, comment down below. And I also have a free checklist that goes along with this training. So if you would like that free checklist or you want the slides to this, just comment down below and I will get you set up with that. All right, happy Friday, everybody. I'll see you next week for our training.